The prevalence of myopia worldwide has nearly doubled in the past 40 years. Over 40% of people in the United States are nearsighted, and that rate is much higher in some Asian countries. There are several factors that can affect the likelihood of a child to become nearsighted. Some of those are genetic and others are environmental. There is a hereditary component to myopia risk. If a child has one nearsighted parent, they have a 25% risk of being nearsighted themselves. If both parents are myopic, that risk jumps to 50%. While we cannot modify this particular risk factor, if you are nearsighted, you should monitor your child's vision closely and make sure they get yearly eye exams. Since we now have options to slow the progression of myopia, it's helpful to diagnose it early. There are also some environmental risk factors for myopia. Studies show that spending more time outside decreases a child's risk of becoming nearsighted. Natural sunlight appears to promote healthy eye growth and can reduce the risk of myopia by as much as 50%. While spending more time outside does decrease the risk of becoming nearsighted, it does not appear to be as effective at slowing progression once a child is already myopic. Time spent on electronics can also affect risk. School-age children who spend 7+ hours per week on computers or mobile devices triple their risk of developing myopia. While computers are often needed for schoolwork, additional screen time beyond that needed for school should be limited if possible. Encourage your children to play outside instead. Finally, if your child is already nearsighted, be sure to ask your eye doctor about myopia control strategies, such as orthokeratology, myopia control soft lenses, or atropine. We now have more options than ever to help limit myopia progression, so be sure to have your child examined yearly by your optometrist.